Day. Hey, Kendall, how are you? We got a good hour before the game comes on, honey. Indiana and Miami are playing tonight, 7:30 Eastern Standard Time. And who don't want to miss it is me because I hop up every 2 hours to pee all night long. Friend, same. You know we're supposed to cut that water drinking off by a certain time of night. Our water and our caffeine drinking, but we don't always do that. Thanks for sharing the live out. So this is kind of piggybacking off of the live that I was on earlier for a hot second as a guest with charge nurse Keisha. So I wanted to do a spin-off of that live to talk about GLP-1s versus weight loss surgery because there have been some questions asked in Keisha's live. Hey Rose, how are you? With regards to how do you maintain when it comes to VSG and GLP-1? Like, what's the difference between the two? Why one over the other? And or gastric bypass. Hey, Toya, welcome inside the side. Hey, Nadine. Welcome in, welcome in, welcome in. So that's what we're going to talk about tonight because there were lots of questions in the chat and I was working on schoolwork, so I could not stay in the live as long as I wanted to be able to answer other questions. So again, welcome in. My name is Kima. I go by Ask Nurse Kima on all platforms or Kima Nichelle. And tonight's topic is about GLP-1 weight loss surgery. Any question that you have about that, I'll definitely try to answer those questions. So in addition to questions in regards to Amble, how to get started with Amble, the anti-aging products that we have that are on sale right now. Hey Salsa, how are you? Welcome in, Boo Bear. So if you are new to me, drop a heart in the chat and let me know you're coming in from. But welcome in. How are you, Boo Bear? Hey Gina, how are you? Welcome in, welcome in, welcome in. So earlier when I was in Keisha's live, someone asked a question because she has had weight loss surgery. Gastric sleeve is what the young lady had, but she's now taking a GLP-1 medication. So she was kind of asking, like, what's the difference? You know, how does the surgery differ from taking the GLP-1s? And so my point in comments, I should say, is that the medication GLP-1s and the surgery plays on the same hormone, that hunger hormone. And we're talking strictly from managing chronic obesity. Let's just stick to managing chronic obesity. Hey Gina, how are you? And when you have bariatric surgery, gastric sleeve, they go in and cut out a portion of your belly. Okay, and that portion contains the ghrelin hormone, the hormone that gives us the signal to eat, the signal of food noise. So they would just remove that part and leave you with this little small sleeve that looks like a banana. I'm not against, so let me just say I'm not giving medical advice. This is just nurse-led education. I have treated a lot of patients that have had bariatric surgery. I have family and friends that have had bariatric surgery. Hey, Sean, how are you? So I'm pro surgery. Whatever it is that you want to do, I'm all for it. I just ask that you do the research, you have all your questions answered, and that you don't be on that table with any unanswered questions or stress or being uneasy about whatever it is that you're going to do. Hey, Prince of All Ferguson, how are you, my good brother? Welcome in. So that's kind of what's driving this conversation tonight because I want to tap back into it. Okay. And again, if you are new, drop hearts in the chat. If you're not already following, make sure you hit that profile picture and follow. Turn on your notifications so you can catch me when I go live. My goal is to go live in the mornings, like at 7, but it was a holiday today, and I was like, I don't think people are gonna be up at 7 o'clock in the morning. But little did I know, people were really up. Okay, so welcome in. So I have my talking points, and so we're gonna go over. It's a lot of information. So whatever we don't get to finish in this live as far as discussion, then we can pick it up tomorrow morning. So just a quick overview. Quick overview. Oh, what is this? Okay. Not all weight loss tools are created equal. Sometimes it's not about the weight loss at all. It's about survival and quality of life, and which is what I was saying earlier in Keisha's live. We have different reasons why we take meds or why we have the surgery. So this is educational purposes only, nurse-led education. Everybody's history is different. Everybody's goal is different. So we're not on here to, dismiss any of that or to get into someone's medical history in this space on this platform. Okay, so tap and follow. This is about real life conversations, real wellness, things that I've experienced as a nurse, as a patient, on the meds, and then being a caregiver to people that have had the surgeries. Okay, so what are GLP-1s? Semaglutide, tirzepatide. So your semaglutide will be your Ozempic, your Wegovy. Ozempic is FDA approved for type 2 diabetes, as well as cardiovascular protection. Tirzepatide is Mounjaro, your Zepbound, which also has Zepbound has the indication for, not Zepbound. Zepbound is an indication for chronic obesity. Mounjaro has an indication for sleep apnea, kidney disease, fatty liver disease, diabetes, cardiovascular risk. Try to get all that out. And they're continuing to add different indications based on data that's been reported by patients like us, people like us that take these meds and report back to your providers reporting back to the agencies or manufacturers. Let me say it like that. So how do they work? Slow gastric emptying, they reduce your appetite, improve insulin sensitivity, and help regulate your blood sugar and inflammation, because they do have anti-inflammation properties in these MEDs. So pros of taking GLP-1 is non-surgical. It is reversible. You can stop or adjust the dose. It improves your A1C, insulin resistance, and inflammation. It's helpful for joint pain due to weight reduction. Often used as short-term or long-term with lifestyle support. Okay, so those are the pros of GLP-1s versus surgery at this moment. Okay. Now, some risks for GLP-1s, cons that we know about are your GI issues, your side effects. So if we can repost, if you all will repost the live to your page, your stories, drop hashtag FYPs, that will be great so that we can get more people in, because there's a whole space here on this platform for the GLP-1 community. There's a space for the weight loss surgery. There's a space for specifically VSG versus gastric bypass. So there's spaces, there are people here on this platform. They're separate communities, okay? So not that I'm trying to just blend the community, but I'm trying to educate. That's really what it is, okay? So some risks are GI, your nausea, constipation, diarrhea, muscle loss if you're losing weight fast. Resistance training is something that is not always prioritized when someone is taking a GLP-1. They take the shot, not necessarily exercise. I hope y'all got your water. Okay. It can slow down your metabolism if you're under eating. That's why it's so important to make sure you get your protein in, get your fiber in, minimize your carbs, minimize your FAT intake. Taking the GLP-1, it requires consistency and lots of monitoring. Were you awake when your UFE procedure was done? Yes, Zola, I was. I was lightly sedated with fentanyl, and I forgot what else they gave me. But I was awake. I knew what was going on, but couldn't feel a thing. A good fit, someone that is a good fit for GLP-1s is someone that is mild to moderately obese. Someone that's pre-diabetic, has insulin resistance. People wanting to drop, their LBs. People that are, of course, diabetic, but not necessarily those that are surgical candidates, because there is a difference. Hey, Monty, how are you? Welcome in. So did you stop your shot? I did, Zola. I had to stop it 2 weeks ahead of time. I have a UFE playlist, Zola, out on the page, so you could definitely scroll through, because I definitely documented that journey. But tonight's conversation at this point is about the topic listed up there. But thanks for asking. So let's talk about the gastric sleeve. So I'm trying to get this explained in about 10 minutes or so. So someone says, I had bariatric surgery 2007. What do you think about the revisions? So I actually have a sister that had the revision. I did not want that for her, but I'm not against it if that's what you need. I had more concerns as it related to my sister. But if that's something that your doctor is okay with you having, then I didn't do so. I just say, do your research, ask all of the questions, make sure everything lines up with what your goals are, and go for it. But I'm not against it at all. I personally did not want that for my sister because I know the type of work that is required, the diligence, the consistency. And I was a bit concerned as a sister that my sister would not be as consistent as she needed to be. Hey, Crispy, how are you? Welcome in. The revision is when they go in and do a duodenum switch. Now I've heard some doctors, surgeons will go in and snip your stomach again. I've just heard talk. I don't know any surgeons personally up here in this area that do it. My sister had her procedure done in Georgia, but it was not in Atlanta. So when we're talking about the gastric sleeve, they remove 75 to 80% of your stomach, which restricts your food volume. But it does not reroute your intestines. Okay. VSG, gastric sleeve, same thing. It removes 75 to 80% of your stomach, okay, which includes that ghrelin hormone. The pros of having a gastric sleeve or the VSG is, of course, your significant WL, okay. It lowers your hunger hormones, which ghrelin, GHRELIN. GHRELIN. Crazy how insurance will cover weight loss meds and not GLP. So Crispy, I was saying this to Keisha as we had a conversation. So back in the day, it used to be hard to get the surgery. But let's think about it from a business point. Now, I have a master's in business and I worked healthcare leadership for years before I became a nurse. So let me give it to you on both sides. Back in the day, it used to be hard to get approval for the weight loss surgery because of the cost, the side effects, people being constantly sick after that and having risk factors that sent them back into the hospital. So it was always an issue with getting the surgery approved. However, now moving forward, it is cheaper to have weight loss surgery. It's cheaper. Let's just call it a spade a spade. You can have this weight loss surgery for less than $10,000. 1 month of meds that the insurance will pay for is like $22,000. And you talk about them paying for this medication for 3 years, 4 years, 5 years, or the rest of your life. So, do the math. And that's just what it is. I mean, there's no other way for me to say that because that's just what it boils down to. It is easier now to get the weight loss surgery because it's cheaper. It's a one-time fee. And some people do have success. I mean, I know people think the vast majority don't, but that is so not true. We need to start pulling evidence-based practice and studies about it before we start, splurting out numbers and statistics and stuff like that. It's definitely about $1. So I get it both ways. I understand. And I'm a firm believer of do what you want to do, what's affordable for you. If it's the MBDs or the surgery, I'm fine either way. As a nurse, I can take care of you either way. I am not judgy at all. You know what I'm saying? But that's really what that is about because it's not always been that way. It's that way now because of the cost of these GLP-1 meds. Now, if the manufacturer would drop the cost down, I'm sure that would change. But here we are, right? So the pros of having gastric sleeve, pros, again, no intestinal bypassing, lower your hunger hormones, that's your ghrelin, and improves your diabetes, blood pressure, and sleep apnea, which is also something that is an improvement in of taking the MEDs, okay? So cons to having weight loss surgery. It's a surgery. It's a surgery. You are going in to be cut, whether they're doing it laparoscopically, because at one point with the gastric bypass, they were cutting you open. You would have this big old scar, in the middle of your chest and belly. Now they can go in and make a couple of incisions and you had the surgery done, so it's not as invasive because they don't have to cut you wide open. Of course, there are risks for GERD, acid reflux, nutrient deficiencies. That's possible. That's actually possible either way in any method of dropping LBs, especially when you're dropping it fast. Okay. Surgical risk, bleeding, leaks, and infection, which can occur with any type of surgery. Those are typical risk factors for any type of surgery. The weight regain is possible if habits don't change. Let me say that again. Weight gain is possible if habits don't change. So, friends, we have to figure out the reason that we have those habits. Why are we? Is it stress, emotional eating? I said earlier on Keisha's live, I said, when I get stressed, I want to go have me a cocktail. I just want to have me a cocktail and just relax. That's what I want to do. It's not necessarily eating. You had the sleeve done in 2013, lost 100, unfortunately gained it all back, and have, I want to see what you said, Zola. And have bad GERD now. Yes. So are you on GLP-1s now? And why do you think that you gained it back? Tell me why you think you gained it back. Hey, Candy, how are you? RNY, my insurance paid for United Healthcare did. 7 months post-op. Congratulations, Candy. Someone having the surgery, a good fit for the surgery would be someone that has a higher BMI. Someone that has a higher BMI. Someone that has failed multiple non-surgical attempts. Those needing a faster weight reduction. So when I was talking with Keisha, have treated patients that needed hip replacements, but because of their size, the doctor did not feel comfortable operating on them because they would need to be under anesthesia for a long period of time or longer. So they wanted them to have the gastric sleeve first, because that procedure, 30, 45 minutes, you in and out of there. You know what I mean? Like it's outpatient unless you have some serious stuff that need to be monitored. In some cases you can stay overnight. But other than that, it's not like you have to be in the hospital all week long. So there are providers that want their patients to have the sleeve done before their hip replacement because they are heavy. But that hip replacement, they need to be under, and they have a higher risk of mortality if they have the hip replacement before losing the LBs. So there are different reasons as to why people need these weight loss surgeries. So we have to keep that in mind when we are having these conversations. Hey, Keisha, how are you, sis? You're supposed to be taking a nap. T vegan, yes. You lost 112 in 2016 and maintenance with GLP-1. Yes. So let's talk about it, because bariatric providers are operating, okay, sleeve or bypass, and then writing the script for the GLP-1, because they really want you to have the best outcome. They really want you to get those LBs off so that you will become healthier and have a longer life, a better quality of life. So yes, but think about it. Why do we feel like you have to choose between one or the other? Who put that, stereotype in your head? Who is doing the fear mongering to say you can't have both? If the insurance will pay for both, why can't you have both? If your doctor write the script and you qualify for it, why can't you have it? So I don't understand where the conflict comes from, where we are going between, VSG and bypass and GLP-1. We all need help one way or another. Thank you for the heart. Hey, Vivi, how are you? So that part I don't really understand. I don't get it, what the fight is about or the argument is about. I believe get what you can get, especially when you talk about what the insurance is going to cover, as long as you are at peace with whichever way you're going. You have papillary thyroid cancer, and my doctor advised against GLP-1. What do you think? Twisted sister, I don't give medical advice. If your doctor advised against it, what I would ask you to do is get a second opinion. If you don't agree, because it sounds like you don't, that's why you're asking the question to the nurse that really can't answer that question. Get a second opinion. Your insurance company probably has an option for you to get a second opinion. Most insurance companies have partners, outside vendors that will conduct a second opinion, find another provider, expert provider that does not even know you, that's not even in your area, to review your case, to make recommendations as to other options for you. So check that out. Candy, well, I've lost 45 on OZ. Then you went to MJ, lost 85. Okay. How was you were 371 and now you are 225. Congratulations. Thank you for the heart me. I appreciate that. Your insurance stopped covering your meds. And there's a number of reasons why, because again, so many thoughts go through my head because if you don't know, I'm a certified case manager. So a lot of the things that we talk about in this community, I see in real life on my regular job. Case by case is crazy. So let me just say what I am seeing in that space is that the pharmacy benefit managers are now partnering with other vendors to manage you when you are taking Wegovy and or Zepbound, because you're supposed to be on that to manage your chronic obesity. If you have other comorbidities that can be approved through Mounjaro, I suggest you go that route because they're not managing your LBs and your journey on Mounjaro or the Ozempic, but they are managing it if you're taking it for chronic obesity. You understand what I'm saying? Is it allowed in NCAA? What is NCAA? That sounds like something that people be mixing up in their drinks. So they are managing you based on that agreement between the PBM and that outside vendor. So the vendor says, hey, we're going to allow your members to get access to Zepbound and Wegovy, but they're going to have to sign up for this plan. We're going to monitor their labs. They're going to have weekly check-ins, know what they're eating, putting the calories in this system, using this app. And we're going to move them up on the dose every month because every 4 weeks is going to be something different. And if by month 6, they have not dropped 30%, then we're going to cancel them. But that's the plan that your provider, your employer has agreed to have with that PBM and that outside vendor, just part of your benefits. Is it college sports, girl. Now, I love some sports, but I was not thinking NCAA like sports, basketball. I was not thinking that, or sports in general. So Sarah, honey, I couldn't tell you what they allow over there unless you're telling me that's what they do. But I see patients that are taking Zepbound and Wegovy that are diabetic, that have high cholesterol, that have high blood pressure. And I'm asking, why are you taking the Zepbound? Well, that's what my doctor said. No, you need Mounjaro because you won't be monitored like that. You don't have to go through that special program. And that's super important. So even though your priority may be the LBs, think about your body as a whole. What other comorbidities do you have going on? And what can you get covered with those other comorbidities? That might not be a hassle to you, like getting the Zepbound or the Wegovy. So we got to kind of think about that. We got to learn how to play the game because the game being played with us. Okay. So getting back to, and make sure I don't have any other questions in the chat because I don't want to ignore anybody. Thank you, Side to Side, for pinning that. The risk for having, let me go back. Okay, back it all the way up. This is gastric bypass. Okay. Gastric bypass is a small stomach pouch. Okay. The gastric sleeve is like the size like a banana. Okay. Sleeve. So versus bypass pouch. Okay. Where they reroute part of your intestines. Okay. Restriction and malabsorption. Okay. But the pros, these are the pros for gastric bypass. It's most effective for severe obesity. Severe. Like people that, what does that show? 600-pound life or something like that. Yeah, definitely tap the screen. There's 75 people in here. If you are new to me and never been in my live before, my name is Kima. I go by Ask Nurse Kima. I'm a registered nurse. I'm a certified case manager. In general, I come on this platform to share my journey. My highest weight was 330. I'm currently 144. I think when I got on the other day it was 144. Still at 144. but I have used GLP-1s for over 3 years, Manjaro and had Compound. So I share that journey. Tonight's conversation is a spin-off of the live, a question that was asked in my sister's Charge Nurse Keisha's live about GLP-1s with weight loss surgery, specifically gastric sleeve or VSG. Okay. So we just kind of getting into that because I wasn't able to stay on the live as long as I wanted to. So again, people that are extremely severely obese, the bypass might be an option, a better option. Rapid improvement in diabetes is a pro, often recommended for people that have severe reflux, okay, and long-term metabolic benefits. Just a few pros for having the gastric bypass. Now let's talk about the risk factors. Permanent and complex surgery. Okay, so it's not as quick as the sleeve, the procedure, even though they can do it laparoscopically, it's not as quick. Okay, higher risk for deficiencies when it comes to your nutrients, your vitamin levels. You may experience dumping syndrome, which you can experience dumping syndrome with the sleeve as well if you're not monitoring your sugar intake and your fatty foods, the fat intake. Kendall has posted the prices there to get compounded GLP-1s through Amble Health, which I am a patient and partner through Amble. So definitely check the LINK, my BIO, for all the things. There are a number of resources in that link, okay, and right here on TikTok Shop, okay, or TikTok platform. Lifelong supplements are required. Higher surgical risk than the sleeve. So let's talk about supplements being required because I get this question a lot. And in the beginning, before tirzepatide hit the market, and doctors were educating about supplements that you will need to take. Hey, Miss Lois, after having the surgery, they're no different from the supplements that we can take every day, like your regular multivitamins. Now, if you're over a certain age, you might need that extra calcium in there as well, but you're going to need that anyway as we continue to age. Now, were they pushing their bariatric brand vitamins, bariatric brand shakes? No different than people capitalizing right now, Starbucks, Dunkin', and everybody else about protein coffee, protein this, protein that. The menus are changing to accommodate the GLP-1 community. Is that this concept is marketing 101. Know your audience. Okay, so that part is really no different. The supplements that I have, I mean, I don't care. Pick one. Pick a supplement. Who cares what you take? Who cares? Just pick whatever is affordable for you, and make sure your doctor knows everything that you are taking, whether it is prescribed or over the counter. But vitamins are vitamins. But when you talk about rerouting intestines, yes, you do not absorb your nutrients the same because the food is not even able to sit. It's not even, girl, it's not able to sit because you can have that dumping syndrome. So it's just passing straight through, you know. So you will see or have seen some cases where people end up back into the hospital because they stay sick after that. But of course, statistics show that now, 2026, people are not having to go back to the hospital as frequently as it used to be 15, 20 years ago. But there's always risk factors with any procedure you have done, just like there's side effects for any medication that you take. So like I said, good fit for someone that is severely obese, if you have uncontrolled diabetes, severe GERD, and other methods that you have tried have failed. Hey, Tamika. Hey, sis. How are you, BW? Why, and I ask this, why do doctors recommend or require weight loss before like any other procedure? And I kind of hit on that earlier. And I gave the example of the hip replacement. But think about someone that needs triple bypass. That's 400 pounds. And they need a triple bypass. The triple bypass is important. It's a priority. But the doctor, when you are a provider, this is the nurse practitioner student talking. When you are a provider, you have to think about holistically the risk for every situation. What is the priority treatment, and how is that treatment going to affect every other comorbidity that the person has? So even though the patient needs a triple bypass, they're 400 pounds. What is the likelihood of me putting them on the table to have this surgery and it being successful and not ending and being unalived because they're under anesthesia for a long period of time and they already have high blood pressure. They already are diabetic. Okay. The cardiovascular output function is already low. Okay. The EF is at 30%. Like, so the doctor will recommend, let's do this sleeve first, because you don't have to be under anesthesia for as long as you will for the triple bypass. Then you can get some of that weight off. So when we do this triple bypass, your risk factors are lowered. Okay, so those things are important. Better healing always post surgery. Come on, thank you, BW nurses in the chat. Hello. So we have to think about that, because I know sometimes we're in this space speaking as creators, we're talking about GLP-1s and we think about PCOS, yes, metabolic issues, insulin resistance, but a lot of times people have other comorbidities that they may not be talking about in this space. Hey, Tiffany. Hey, Rise and Shine Queen. Okay. And not because it's not important, you know, that's just a safe secret space like that. You don't always want to give out all the information to people on the internet. You know, everybody's not here as the creator. Some people are really here just trying to get information, trying to figure out how to become an advocate for themselves, to have these conversations with their providers. Can you do GLP after gastric sleep? Yes. And you hit menopause, you can still take these MEDs, my friend. Yes, you can. Yes, indeed. Thank you for the heart meets. I appreciate it. Trunks of love. Let me see. I thought I saw something else. Okay, make sure I didn't miss. And so, yes, people get upset when doctors recommend having the surgery before, but it's not because they're not trying to have the best outcome. It really is because they're not trying to upset you and say, oh, I just want to cut you twice. I just want to get your insurance. If I had a penny for every time I heard a patient say, I don't need to have this surgery, he just want my money. You know, it's a million of us out here. There's 1,000,002 surgeries that doctors can perform that you need to just be fraud in the system to cut on you for no good reason. Because you know it has to be a reason. That's the whole medical necessity piece behind it with the prior authorizations. So doctors are not necessarily trying to be cruel. They just are like risk-based, you know, and that's something that I am learning, you know, in my journey, you know, becoming a nurse practitioner, because I'm not supposed to think like a nurse. I'm supposed to think like a provider. You know, how can I prevent XYZ from happening next based on the side effects that you coming in this office talking about? You know what I mean? So it's a mindset shift as a provider, which I am learning at this at time and space. Reasons why surgeons require weight loss. Again, lower anesthesia risk, reduce surgical complications, better wound healing, like BW said, better wound healing, lower infection rates. Because I'm always preaching, you want to know your doctor's infection control rate. Ask the question. Sometimes people don't think about that. Hey, Slim, how you doing? People don't think about infection control rates. They're looking at pictures and outcomes as far as bodies and you know, things of that sort, depending on the surgery you're having. But you want to know that too. You want to know how clean their environment is, because you don't want to have an infection, especially one that is not common, like me having my tummy tuck and developing a seroma. That's a common side effect. But I don't want to have no infections. I don't want my wounds, my surgery scar to open up, you know, to dehisce, to have an open area. I don't want that. So those are the questions as a nurse that I'm asking, you know. Less stress on the joints, better long-term surgical outcomes. Okay. Why bariatric surgery is sometimes required. GLP-1s may not work fast enough for the patient. Okay. May not work fast enough. Not that they won't work. They might not work fast enough, which is again why it's recommended you can take those after, why doctors do prescribe it after the fact. Okay. And I can say that I've seen a shift, even with my provider and the doctors that I work with on a daily basis. We actually now have a team of physicians that we call our GLP-1 champions that get together to provide education and forums as to why GLP-1s are necessary, why we need to prescribe them more. versus in 2022 when it was like, we ain't giving you nothing. You had to go through so much to get a PA approved. I have been grandfathered in. I get my brand from UHC. I have been grandfathered in, which is why I'm so happy that we have these providers now that are so GLP forward thinking when it comes to these MEDs. You had gastric bypass 17 years ago, and how are you feeling now? I was 250, had gastric sleeve, went to 120, got sick, hit menopause, and now 173. GLP-1 can help bring you back down. It's hormonal, okay? The menopause, GLP-1's endocrine medications that treat your hormones, okay? But definitely have a conversation with your provider about it, because it is not hard for them to write a script. Just found me and Nurse Keisha. Welcome in, Quest. Thank you. Absolutely join the Amble team. Absolutely. So BMI thresholds are tied to insurance outcomes. Again, I keep trying to tell y'all, I'm a certified case manager, but I've been in healthcare a long time. And I have loved working with managed care companies. That was my specialty before I became a nurse. So if anybody knows how to get around, I know how to get around some things. Okay. I've learned over time what that documentation needs to look like. Thin in hair, please help Mary Roots Carly too. Mary of the Root Carly too. That's what you do. Because at the end of the day, our medical directors have their metrics just like I have mine. You know, my goal is to educate patients, to get them off so many, well, let me say my personal goal is to get them off so many medications, to make sure they understand why the doctor has recommended certain meds, and if we can work around it, we will. That's my personal goal, okay? To provide my patients with every opportunity so they're not having to go to the doctor every month. They don't have to have 6 specialties. You know, I don't like it. So the doctors have their metrics as well. Okay. So we would look and monitor the cost. Like I look at cost of meds for patients. I look at how many times people go to the ER, why they go to the ER. And if it's too high, I send it to the doctor for recommendations. Like, what else can we do? This is what I'm doing. These are the resources that I have provided for them. These are the benefits that they are currently using, but it's clearly not working because they have a bill that's $1 million. What else can we do? You know what I'm saying? And sometimes my medical director's reviews are strictly based on medications, autoimmune diseases, GLP-1s. To be honest, anything that's hormonal related, those usually are like high cost. So I see those a lot. But my intent, I'm going to repost it, my good sister, is to provide that education. But like I'm saying, the insurance companies, they look at all of that stuff because everybody's out to make money. Let's just keep it a book. Everybody want to make money. So those things are important as well. And when I see like claims for someone going to the ER 10 times in 3 months, the first thing that comes to my mind is they either don't have a PCP, they live in an area where there's no urgent care, or they don't have, no, I can't say don't have insurance because I've seen people that don't have insurance, but that's when I work bedside in the ER. But it's usually they don't have a provider to help manage their care. Is Jen's in here? Hey, Jen's. Hey, Shannon. Thank you for the heart. They don't have people to manage their care. So they're using the ER as the doctor's office, getting the script and then going home for whatever period of time until something new happens and they go back. So my goal is to make sure when I see ER visits like that, that I go ahead, assess their whole situation to find them a PCP, get the appointment scheduled. If they need medications, I try to make sure they have every coupon card necessary to the point that I fill out the coupon card for my members while they're on the phone with me, send it to their email. So all they got to do is here, take it to the pharmacy, show the pharmacy, you know. But realistically, we just have to be open to why the insurance moves the way that they move. And we just have to learn how to navigate that. You know, there are times when certain things go on in the world that are not necessarily beneficial for everybody. When COVID hit, I always say that was a horrible time. for society. But for the clinician that did not get sick, that was able to work in a safer environment than some of the people that were in New York, that was a time where we could really come up from a financial perspective. I have friends that paid off student loans, friends that paid for their house in cash, bought cars in cash. You know what I'm saying? So even though it was a horrible time, it's like we had to learn how to navigate through that time to make it work out for us. You know, I remember when the housing market went upside down and I was getting ready to move to Atlanta. There were houses that people lost in foreclosure. 7,000 square foot house for pennies on the dollar. And I'm like, how can I make this work for me? It's situations like that. I'm just giving examples. Thanks for sharing the live. I appreciate that. Thanks for the heart meets. For all 84 people that are in the live right now, if you're not already following, definitely tap that picture in the corner and hit that follow button. Tonight's live, we're just talking about GLP-1 versus weight loss surgery, because this was a question that was asked in Keisha's live earlier, and I was not able to really expound on it because I was doing my schoolwork. So I had to kind of tap out the live. But surgery success depends on your body mechanics. Same way if you're taking these GLP-1s, even though it is not necessary. Let me just say, the fact of the matter is, do you have to work out taking GLP-1 meds? No. It is not mandatory. However, if you do, the outcome may be a bit better for you. Okay? Your weight loss may be more sustainable. If you change how you eat, how you look at food, the outcome will be better. If you tap into a mental health coach to figure out what makes you eat how you do, why do you have that need to overeat or stress eat? Let me say it like that. You know, people that have weight loss surgeries also can take the Cressemia, the Contrave, the Wellbutrin, because you have to, most insurance companies require like that clearance from a dietitian, and they require clearance from psychiatry, you know, to be approved based on your insurance requirements to have the procedure. But the point of that is so that you understand the commitment that is necessary on the journey. It's about the commitment. Understand this is lifelong. Understand once you go down this road, this is what is expected of you, you know? And don't get me wrong, because trust me, trust and believe. I have met people that know how to answer questions. Like we have been taught how to interview to get the job that we want. Honey, it is the same. People know how to answer those questions talking to their psychiatrist. I mean, I can sit here and tell you this is what you need to say myself, you know. So that's part of it. So I asked the question, why do we feel the need to compare GLP-1s with weight loss surgery? Why is there a competition? Why is it this is better than that? Why this community better than that community? Why is it not this is the best choice for me and my goals, my medical history, my family history? Why is it not that we think about our health as a priority, not about who's cheating or not cheating? Is the weight loss surgery cheating? Is the GLP-1 cheating? No, it's about having the access to be able to take care of yourself, the access to become more healthier, to have a better quality of life. Because at the end of the day, that's what we all want. Tori says, yes, I had to make that choice to save my life. Absolutely. And Tori, even with you saying that, earlier in the chat when I started talking and I said my sister had the sleeve, and then she later had to deal with Denham switch. I did not want my sister to have this surgery, not because I didn't believe in the physician. It's I know my sister, and I wanted her to understand this is a commitment. Are you serious about it? You know what I'm saying? But as a sister, I had to let go because the nurse in me understands, respect the patient's choice. My sister's the patient. That's her choice. So I had to stand behind her 10 toes down, despite how I felt as a big sister. You understand what I'm saying? Hey, Kim, how are you, friend? So that's what we're talking about tonight. So if you have questions, drop them in the chat. If you need to send me a message privately, you can do that. I will respond. Honey, I got real good with doing these voice responses because it's way easier than typing. Okay. So GLP-1 versus surgery, it is not a competition. These are tools. Okay. I'm looking at the time. I got a few more minutes because, honey, the game come on at 7:30, honey, and we going for the U. I'm just saying. No hate on Indiana because I do believe that's Tiffany's team. Okay, rise and shine. GLP-1s and bariatric surgery are tools, not moral judgments. We need to think about that. No, I'm watching that game. So some patients use the GLP-1s before surgery to lower their risk, surgical risk. Water check. Woo! Get your water. Baby, I need that so bad. Get your water. Oh my God. Toy says, anybody not rooting for the U of Miami? Oh my God. Not may your lights get cut off. Oh my God. In 3:05 minutes. Oh my God. That's hilarious. You know, I got my family, the Brantleys, Florida Brantleys down there going for the U. You know what I'm saying? So some people use the GLP-1s after surgery to prevent regain. Okay. So choosing surgery versus the meds there are options to this. Okay. It does not mean one is necessarily better than the other. You can have them both. 3 of us on GLPs. Yes, you can have them both. The surgery, nor saying I'm going to take the GLP-1s, it's not easy. It's not easy. You know, I read comments about people wanting to start the journey, but they're worried about giving themselves injections. It's still a big deal. You have a Brantley at your church. I'm pretty sure it's one of my cousins. I am pretty sure of that. But we can talk about that, Toya. I am pretty sure, honey. They thick down there in Florida. I was seeing something. Somebody said something. Are liquid NAD boosters any good instead of the injections? I don't know anything about NAD boosters. I'm gonna have to look that up. The next day with the staph infection, it did. Cynthia, tell me what you were talking about, because whatever you said before the comment that's pinned, I didn't see it. So somebody find that comment before this one so I can understand what Cynthia's telling me. So can GLP-1s replace bariatric surgery? Now that's $1 million question. Okay, so we'll go through a few. Kenny says, I was at a crossroad of my life. And it happens, Candy. And it happens. That's exactly why I said I had to back up off my sister. I had to back up off her because I was being selfish. Me not allowing her to make the decision that was best for her health goal was Kima being a selfish sister. That's what it boiled down to. Tori says she was on GLP-1s, which I know Tori from a while back, and now 3 months post-op from the bypass. Tori, how are you feeling? How are you feeling? What is there a difference for you, Tori? Is there a difference for you? Your GLP-1 journey before bypass? And are you going back to taking the GLP-1s? Let me see. The shade. Okay, hello. I started compound. Okay. It was oral flow 1. What is that? So you were taking flow 1. I don't think I've ever heard of that. If there are any other nurses in the chat taking compound flow 1, because I have not heard of that. Honey, you making me go to the drawing board, honey. You're thinking about getting the weight loss surgery, and that's fine. My thing is your insurance going to cover it? Is there anything that you need to do to prepare beforehand? And make sure those things are done. And make sure that any question that you have about this surgery gets answered. And let me also say this, and I feel like this works for weight loss surgery as well as taking GLP-1s. If you are in a relationship, married or dating, in a committed relationship with somebody, and they are not as healthy as they should be, or they suffer with chronic obesity, and y'all do not see eye to eye on either way, whether it's the GLP-1 med or the surgery, y'all need to have a come to Jesus meeting with a mediator. Because what I have seen happen is when one drops the LBs, the other one get real jealous, get real cray cray. Okay, and it's crazy. And I learned that from being with a provider, and he was telling me you have to have these conversations. The doctor literally said he has counseled a husband and wife because they both need to have the surgery. One said yes, the other said no. And when the wife dropped the LBs, the husband got mad and started verbally abusing the wife. And then the wife started cheating. And guess what? They had a divorce because the person that lost the weight got their confidence back. So they were no longer listening to the rah-rah from the husband that was still chronically obese because they don't need to hear that. I've dropped the LBs. I'm doing what I need to do. I'm going to the gym. I look good. I don't care what you're saying. I'm outside, you know? So you need to have those types of conversations because I can say being on a GLP-1, I don't, of course, eat like I used to. So that definitely interfered with like how my husband and I, before we got married, how we were dating. Honey, the biggest part of our week, Friday, Saturday, and Sunday, because we going out Friday, Saturday, and Sunday, and we're eating and we drinking. And we might go to a couple of spots each day. Very few times that we double back to the same spot. We was always going somewhere new. You know how it is in Atlanta. You can go somewhere new all the time. Tori says, I'm doing good now. I have no food noise. I have to make myself eat, which happens. Set your alarm, set your timer so that you can get the food in because it is necessary for our organs to function. Miss Ron said, I ended up with, oh, where did that go? The jealousy does come. It does. It does. I ended up with a blood clots and gout after your RNY in 2014. You're at higher risk for so much infection and complications, and it can happen. That's part of that consent to treat. The little print at the bottom that sometimes we don't like to look at, or sometimes people that really do read it will not want to sign their consent because they don't want to have to admit that they read that there are risk factors associated with that surgery. Because I've had that happen too at bedside. I'm like, Miss Ma'am, you knew we was getting ready to roll you back. You know I got to get you to sign this consent before I roll you down this hallway. But I've had that. We've had to call the doctor in because it is not the nurse's responsibility to explain the consent to treat and what's getting ready to happen. We're telling you what it is, but your doctor needs to come in and answer any question that you have. Okay? It is not on the nurse. It is on the surgeon. That's his responsibility. Didn't think it would work. I love the community. Teen owned. Okay, starting. Let me click this down era. I hate when I can't see it all. Okay, teen owned. I believe you saying we'll go. It started something. It went away, y'all. I'm sorry. I hate when that happens. You ended up with staph infection the next morning after getting the sleeve. Got you. 3 years of fighting. Got you. Down 7 potatoes. Congratulations, Taja. So and staph. Now we all have staph in our body. Now, so let me say that we all have staph in our body, but we do run the risk of having an infection, being in compromised environments. You know, being in the hospital, in the emergency room when there's bugs going around, the COVID, the flu, the things going around. I definitely had a staph infection on my inner thigh. It was activated by a spider bite. And the way that spider bite about took me out, because it's my thigh swelled up. I mean, it was ugly. But I had to, as a matter of fact, I was not a nurse then. And I had one of my nurse friends come over and treat me, okay? And then I took my behind to the ER and had to take all them antibiotics because it ended up opening up and I had to pack it. You're on Zep. Congratulations. Same thing happened to you, Tasha. My insurance doesn't cover the regular GLP, so the doctor suggested compound. Always. Absolutely. Absolutely. And we have to look at all of our comorbidities, y'all, and the clinical indications as to why these meds can be covered. And like I said, work the system, how the system works us. And again, is surgery cheating? No. Is taking the injection cheating? No. Coverage just definitely depends on the clinical criteria. And if they won't give it to you, ask them to send it to your provider, to the doctor's office that's requesting the prior authorization. Your daughter lost 7. Yes. Okay. You're down 12.12 from 321 to 308 in 3 weeks. Congratulations. It was around all of my areas where I was cut during the surgery. First thing come to my mind, that operating room wasn't clean. That's what they say to me. Operating room wasn't clean. Surgical equipment was not clean. Who? Huh? That's what they say to me. That's what they say to me. Muscle loss is real. It doesn't matter the method. It can be GLP-1s. It could be the weight loss surgery. It could be keto. It could be any method, where you can lose muscle, because that is depending on how fast you're dropping the LB. So that's important. Remember this. Your body is not the problem. The plan has to match the body, the goals, and the timeline. Okay? Whew. I'm doing good getting this water in today, considering it's my day off from work. These are tools. So, if you're trying to figure out which way to go, whether it's surgery or GLP-1s, type in the chat tools, TOOLS. That's right, Miss Ron. That's right. Muscle loss can happen to all. I am here to give my opinion on the journey, have real honest conversations. This is nurse-led education. There are topics that you all like to talk about. You can send me a message. We can talk about it. I'm going to always talk about GLP-1s because that's how I, met everybody here starting on the journey. I didn't even know there was a such thing as a GLP-1 community. I just got on the app because everybody was talking about TikTok and I was still over on IG and I didn't have a TikTok. I started the jab probably about 3 weeks after getting a TikTok account and found this beautiful community. You really appreciate the help. No, it's my pleasure. It's absolutely my pleasure, Cynthia. I love what I do. Hey, Rasha, how are you? Thanks for the follow. Thank you, lovely. I am here. Now you can do like free consultations with me. And that's just because if I don't get a chance to answer your questions or you don't want to send a DM and you just want to talk to me on Zoom for 15 minutes, that's fine. There's a link in the bio to schedule like a 15-minute Zoom consultation. It's free. And I have it scheduled based on my availability, which I know will change next month because my caseload next month is crazy for school, I'm sorry. So Queen says, I was 300. She lost 38 in 4 months. Congratulations. I'm happy for you. I'm happy for anybody that is taking control of their health. I'm happy. Okay. Keisha, I see something. So you can pin your name. Thank you, side to side. Definitely let's tap the 35 and we up out of here. Because I asked my honey to order these wings that I done fell in love with. These mild honey, hot honey wings with lemon pepper sprinkles. Indeed. And that's what we're going to eat while we're watching this game. You're welcome, Miss Rosemary. It is absolutely my pleasure. Is that my bestie in this chat? The Perfect Muse. You started September at 278 and now 248. Congratulations. Very thankful. You think about where would we be if we didn't have these tools? Where would we be? What would we be doing? Would we be this successful without them? And nothing is wrong with it. Don't let anybody make you feel ashamed of taking control of your life. That would be equivalent to you being in an abusive relationship and they're trying to tell you to stay. No. I got to get up out of here. I got to do better for myself. How do I feel about Retta? I'm currently on tours, lost 22, started in October. So Retta is not FDA approved. So it's still in clinical trials right now. So for the people that can qualify to, participate in the trials, I love that for them. But as soon as it's FDA approved, want a little taste. Want a little taste. Because, I'm curious. That's how I live. On the edge. But yeah, so this live really discusses medications that, of course, you can get from your doctor, you can get from AMBA, because I'm an AMBA patient partner. I am a registered nurse, and your girl has to keep a license. So we try to stay above the line. Okay. Hey, Dallas Diva, how are you? You're scared to be a lab rat, but you want to try it so bad. Listen, if you can become a part of the clinical trials, my sister Giovanna is not in here, but Giovanna gives all the tea of how to become part of clinical trials. If you can get a part of that, become a member of a clinical trial, do it. That way somebody is tracking and testing all the things. Okay? Giovanna is not in here, but on TikTok, I think it's J Pelote. She has a couple of pages, but her name is Giovanna. It might say just Giovanna GLP-1, depending on which page you see. If you inbox me, I promise to get you connected with her, because she can definitely have to teach you how to find out about the clinical trials that are available in different places. Not only clinical trials, but what did you call it? I guess it's still some type of clinical trial when they're testing various medications for people that are having plastic surgery, whether it's breast reductions, tummy tucks, thigh lifts. They're testing pain meds. So they have clinical trials for that as well. Giovanna can tell you about that too. Okay. Please inbox me, friend. You're paying $2.99 for your compound. We definitely have some specials right now where you can get 3, 6 month, 9 month, 12-month bundle deals using Klarna Afterpay. If side to side, if you can make that the last thing you post, so people can see the options that we have with Amble, and then I'll be up out of here. Okay. So that's Amble's deal right now. Okay. The bundle deals they have going on for the month of January. And if you sign up and that's the price that you get, that's the price that you will have the entire duration you're on the plan, unless you cancel. Okay. So the price won't change after you've been on it. If you start talking GLP too late, maybe you feel like you started taking it too late, Queen. It ain't never too late, honey. Just start. I should take it a long time ago. Oh yeah, now if I could change a couple of things, I would not have increased my dose as quickly as I was increasing it. I would have definitely been strength training from the beginning, like really, not just focusing on cardio. And I would wish I would have been able to start it when everyone else did, like in July and August of 2022. I started November 1st, 2022. But I found out about it in October, and as soon as I found out, about it, I was clicking on that savings card, and that's what I did. And I later was approved for it through my insurance company because I am a stroke survivor. Okay, it does give me that cardiovascular protection. And someone was in Keisha's chat asking about epilepsy and the medication. I have a history of seizures because that was part of the things that would occur when I had my stroke. I have not had one episode since I have been taking GLP-1 medications. 3 years, a little over 3 years in now. Okay, just food for thought. All right, we're going to get up out of here because the game getting ready to come on, honey. And my moderator is what? Not playing with me. You increased the dose and started getting sick. Yep, because you need to go back down. But again, if you have questions that I did not answer, inbox me. I will respond back to you. Give me a little grace while I'm watching this game, because you might hear the football noise in the background on the message, okay? All right, I appreciate y'all for tuning in. I will see y'all in the morning between 7 and 7:30 a.m. Eastern Standard Time. Get your coffee, grab your water, and let's chat. All right, bye, y'all.